My speech is on Parkinson's disease. Have you ever seen someone that shakes uncontrollably? The first thing that comes to your mind is, geez, that person must have a problem. They shake so much. Do you ever stop and think that they can't control it? A study from Genetics Home Reference stated that 4 million people in today's world are affected by Parkinson's disease. So how do you know if the brain has Parkinson's disease? If so, what caused it? To the left is a healthy brain, compared to the right picture, which is a brain with Parkinson's disease. You can tell the difference through the shape and the holes in different sections of the brain. Parkinson's disease can be defined from the Mayo Clinic as a progressive disorder of the nervous system that affects your movements. The disease results in the loss of dopamine, which can be defined from Phil Newton in The Psychology of the Day as neurotransmitters which help the transmission of signals between the nerve cells and the brain cells. Psychosis, Richmond, Melby, Navigating Life with Parkinson's Disease define 5 stages of Parkinson's. Stage 1 is the symptoms on half the body. Then stage 2, the symptoms from half the body move to the full body. In stage 3, they start moving slow when they're walking and doing other daily tasks. Stage 4 is they always need somebody with them and they cannot be independent anymore. And then stage 5 is when they need medical attention daily when doing every daily activities. Navigating Life with Parkinson's Disease in the National Institute of Neurological Disorders and Strokes defines the following symptoms. You have tremor, the most visible symptom, which consists of the shaking in the arms and the legs first. Then you have the slow movement, also called bradykinesia. And then you have rigidity, which is the medical term for stiffness. The muscles are never feeling relaxed and always tense. Then you have the loss of balance, along with freezing and falling down. Trembling in the hands, arms, and legs, and other parts of the body, and difficulties in the speech. Ferocious, Richmond, and Melby, authors of Navigating Life with Parkinson's Disease, state which the causes of Parkinson's disease are. Age, which is the leading factor. Older people are most likely to have the disease than younger people. This disease affects more men than women. And through science research, it indicates that between 5 and 15% of Parkinson's disease patients inherit the disease. Studies conducted that have shown the large long-term exposure to organic solvents, pesticides, and herbicides are higher risk of developing Parkinson's disease. Now that we have a better understanding of what Parkinson's disease is, here are the symptoms which can help cause them, and let us discuss the treatments offered. Ann Andrews, the author of I Have Parkinson's Disease, What Should I Do? There have been many tests and treatments that help Parkinson's patients. A is medications. The medications include the DOFA, defined by Mayo Clinic by it states natural chemicals that pass into your brain and convert them into dopamine. Next one is dopamine agents stimulants. Some of the dopamine receptors without needing to change into dopamine. This may delay the need for levodopa. Next one is antilogical drugs. Is used to break the tremor by blocking actions which cause the trembling. MAO-B inhibitors block the activity of the enzymes called mercamine overdose B, which can increase the brain in age. Glutamate blocking drugs prescribed like anidopamine to patients with early and mild symptoms to the disease. The other sources of treatments are surgical procedures. The 3 surgical procedures include stem cell transplantation, which are used stem cells to have the ability to turn them into 200 different kinds of cells for the body. These cells could act like dopamine needed in the brain. The next one is deep brain simultaneous uses electrodes that are implanted into the specific part of the brain. The electrodes are connected to the general located part of the chest. It sends electrical pulses to the brain to help reduce some of the symptoms of Parkinson's. The next treatment is gene therapy, which is inserting a healthy copy of a gene into the damaged area. Now that you have a complete understanding of the concept of Parkinson's disease, so how does the patient help deal with the disease? Ann Andrews from I Have Parkinson's Disease, What Should I Do? There are ways of taking control. A is exercise. Andrews stated that exercise makes you feel stronger, reduces stress, and helps you improve cardiovascular fitness. When having Parkinson's, your body is normally tightened, so multiple stretches can help improve that also. One way to help improve the body is through your voice. Andrews took speech therapy to help improve the quality of her voice, which most Parkinson's patients have a problem with. Andrews suggests reading out loud or recording your voice to see how you sound, and then doing vocal exercises to help improve them. Now that we have covered some of the ways to improve the body, we can now have an idea what it's like to have Parkinson's disease. In conclusion, Parkinson's disease is a scary disease to have and something that you cannot ever get rid of. The treatments and medications patients go through many difficult times, along with keeping us in their body, so they need the help that they can receive. With multiple understandings in the concepts of Parkinson's disease, more families can be prepared to deal with the patients and help them get through the process. Thank you.